Are you worried about insulin resistance after taking prednisone? That's understandable because prednisone messes with so many parts of the metabolism. In fact, a YouTube commenter recently asked this. I was on prednisone 50 milligrams for 1 month. Since July, I've been off it and still feel very insulin resistant. Is this irreversible now with diet and exercise? Great question. So let's dive in to what prednisone is doing to your metabolism and finally what you can do to reverse it. And I've got 3 scientific articles to support what I'm going to mention today. If you want to know the links to those, they're in the description below. So prednisone causes insulin resistance because of how it's messing with the metabolism. Prednisone's drug class is actually named glucocorticoid after this effect of what it's doing to glucose, meaning sugar, blood sugar. It's causing higher blood sugar, especially at high doses, like the 50 milligrams you mentioned. It can definitely mess up your normal metabolism, leading to insulin resistance and high blood sugar. So here's what happens. Prednisone increases hepatic glucose production. The fancy term is gluconeogenesis, breaking down glycogen stores. Essentially, your liver is releasing more sugar into your bloodstream. Next, it's decreasing the insulin sensitivity in your tissues, your muscles, and your fat, making it harder for your cells to use up that glucose that's now floating around in the bloodstream. Somehow, it's able to block those and only have muscles that are working. Like if you're running away, only the running away muscles are going to be able to use up that glucose. The other muscles have insulin resistance and aren't able to use it. Prednisone also affects beta cell function, which reduces the ability of your pancreas to make insulin and make enough to compensate for all this extra blood sugar. So back to your question, is prednisone-induced insulin resistance reversible? The good news is yes, it is reversible, usually, but the timing is difficult to predict. And here are some factors to consider as far as the timing. The duration of prednisone use. A full month-long course is considered relatively long, so recovery might take some time. Your underlying health. If you had risk factors for insulin resistance before you took prednisone, such as weight gain, obesity, prediabetes, or a family history of diabetes, recovery may take longer. And lifestyle factors are vital. Diet and exercise play a critical role in weight management and the ability to reverse insulin resistance. So what did I learn from these 3 scientific articles? So the first one was short-term prednisone use and beta cell function. This study found that short-term high-dose prednisone, and in this case, they did 40 milligrams for 3 days, caused a temporary reduction in beta cell function and insulin secretion in those with type 2 diabetes. And even in healthy subjects, they compared healthy and people with type 2 diabetes, and they both had reduced function. But in healthy people, insulin secretion recovered quickly after stopping prednisone. People with pre-existing type 2 diabetes had a greater reduction in insulin secretion and a slower recovery, suggesting that those with pre-existing metabolic issues may take longer to bounce back. For someone who is on prednisone for 1 month, your beta cells might still be recovering, especially if there is pre-existing insulin resistance. The second study looked at prednisone and 24-hour glucose profiles. Again, this was short-term, 20 milligrams for 3 days. And they found that prednisone use caused postprandial hyperglycemia. That means the blood sugar was higher after eating a meal. And this was due to reduced insulin secretion and reduced insulin sensitivity. The study emphasized that these effects dissipated overnight. And they concluded that we should focus on figuring out how to temporarily support insulin deficiency and insulin resistance while somebody's taking prednisone. I love your question, how you asked without diet and exercise, because really diet and exercise are some of the most effective ways to reduce insulin resistance for anybody from any cause. Exercise improves insulin sensitivity by basically opening up the pipes so that the insulin allows the glucose to go into your muscles so you can use up that sugar. Aim for 30 to 60 minutes of moderate activity like walking, swimming, biking on most days. As far as what to eat, Focus on a diet that has minimal processed foods and is rich in proteins, healthy fats, and fruits and vegetables. Losing a small amount of weight can improve insulin sensitivity as well. If you're really concerned about your blood pressure, get a glucometer, a blood glucose monitor. Talk to your doctor about it. Get your blood tested to make sure that your A1C, which is a measure of your blood glucose over 3 months, is still in a normal, safe range. While diet and exercise are fundamental for improving insulin sensitivity, there's a special thing that most people don't know about when it comes to prednisone and insulin resistance. A study in 1999 in Israel showed a way to reverse diabetes caused by prednisone. They found that measuring the urine of people taking prednisone, there was a metal mineral that you naturally have in your body called chromium. And they measured how much chromium was in the urine before someone took prednisone. And then they measured how much chromium was in the urine after someone took prednisone. And it went way up from 150 nanograms per day to 244 nanograms per day. Why does this matter? That's because chromium is essential for glucose metabolism because it enhances the activity of insulin, helping cells absorb glucose more efficiently. So prednisone is actually causing you to pee out chromium. You're losing chromium while you take prednisone, and it's not something that is easily replenished with a normal diet. This is a rare mineral that you normally have in very small amounts. So then they supplemented chromium with those who took the prednisone. They gave 200 micrograms 3 times a day. And that doesn't seem like a lot, but it was a special kind of chromium called chromium picolinate. And they did that 3 times a day. And they were able to reduce fasting glucose levels from over 250 milligrams per deciliter to less than 150 milligrams per deciliter by supplementing with chromium. Additionally, the patients were able to reduce their use of hypoglycemic medications by 50%. So these findings suggest that chromium supplementation may help improve insulin sensitivity to help you recover, to minimize those metabolic complications from prednisone. I'm not going to claim that a supplement with chromium picolinate can reverse diabetes, but giving back chromium picolinate just makes sense, right? If prednisone is making you reduce your amount in your body, you're depleting your stores of chromium and you give it back, it makes sense that that loss caused a side effect and giving it back will minimize that side effect. That's one of the reasons I included chromium picolinate as one of the main ingredients in the supplement I invented called Nutrinize Zone for people on prednisone. I've got that exact dose, 200 micrograms per dose in my morning and my bedtime bottle to support you while on prednisone. You just take 2 in the morning and 2 at bedtime. And that'll help you recover from taking prednisone, help minimize those metabolic complications because you're giving back exactly what prednisone depleted. Just go to nutrinize.com or Amazon to get this today because it's exactly what you need to recover from taking prednisone. And if you're still having lingering effects, talk to your doctor about it. Get those blood tests, get other medications on board if needed. So to answer your question, is this irreversible? No, it is reversible, and there are things that you can do to minimize it. But you already knew what they were, didn't you? Diet and exercise, and maybe supplement with chromium and potentially a prescription medication. I hope this helped, and if you have any other questions, please leave them in the comment section below. Signing off as Dr. Megan, your prednisone pharmacist.